Hello everyone, this is Tori Self, and these are my people watching me present on the herpes simplex virus. Okay, so to begin with, the microbe description of herpes simplex virus, to start off with, there are two types. You have the herpes simplex virus type 1, which is abbreviated as HSV-1, and you have the herpes simplex virus type 2, which is abbreviated as HSV-2. And since this is a virus and not a bacteria, you cannot apply any type of gram staining to it. So therefore it is neither gram positive or gram negative. And then it is also known as an alpha herpes virus, and this is because this type of virus is very good at effectively and rapidly destroying host cells. Alright, so more things about this microbe. There are 4 structural components. To begin with, you have the core, which is where you find all of the DNA that this virus has. It is a double-stranded DNA. And then you have the capsid, which has capsomeres that are arranged all around it. And then you have the intermediate phase, which is where there are tegument proteins. And then you have the outer membrane, which is a lipid membrane bilayer with 5 types of glycoproteins on it. Alright, and then the disease mechanisms of herpes. First, it has to attach to the host cell, and it does this through proteins that are found on the viral membrane, and they connect to the cellular receptors on the host membrane. Once this attachment has been made, it is stabilized in order to make sure that the attachment goes through with, because if it doesn't stabilize, then there will be no attachment, and then the virus will not succeed in taking over the host cell. Next, you have the viral envelope will then join with the host cell membrane. It will just completely take over, so that way it is now completely in control of that cell. And then, like I said earlier, the intermediate phase, which contains all the tegument, well, this tegument is injected into the host cell so that there are proteins in the cell, and there are also proteins in the cytoplasm of the cell. Okay, so on body reactions, first we have symptoms, and in HSV-1, which is commonly known as oral herpes, you will develop mouth sores. So they'll be also called cold sores, and they'll be in and or around your mouth. They are also known as blisters, ulcers, mouth lesions. They're very uncomfortable. And then for HSV-2, you have genital herpes. And for this, you can have these blisters or cold sores, or whatever you want to refer to them as. You can have them in your genital area, and you can also have them in your anal area. If the complications become very severe, you can also develop fever, swollen lymph nodes, and body aches. So as for your body's immune response, there are humoral and cellular responses. The first line of defense against this is your skin and your mucous membranes. So if that fails, then you have your second line of defense, which are your macrophages and natural killer cells. Once these line of defenses fail, which you hope they don't, but if they do, then you have this virus that spreads into your body through your sensory neurons. And then, for instance, if you have a newborn, or if you have any type of immunodeficiency disease, these complications will be magnified greatly because your body will not be able to fight it off as a normal person would. And then if you have infections of your central nervous system or in your cornea, that can also cause your complications to become worse. As for medications, for HSV-1, which is oral herpes, you can do an over-the-counter medication And with over-the-counter medications, they're like okay to use, but it's not the best option just because most of the over-the-counter medicines irritate the cold sores even more, and they then hinder the healing process. So, I mean, it gives you temporary relief, but it doesn't really take care of the problem like you want it to. And then doctors can prescribe Excelivor ointment or Penslavor cream, which is something that you would apply to the area. You can do it while you have the cold sores, or you can do it when you can tell that you're about to have one, so that way you can hopefully stop the ulcer from appearing at all. As for HSV-2, which is genital herpes, they have 3 types of medications that you can use. There is Excelivor, there is Belisivor, and Famcilivor. And they are all kind of the same, like each have active ingredients like Excelivor in them, which help to take care of the blisters around your area down there that may be affected. Alright, and for treatment, you have, for HSV type 1, basically all you can do is just apply the ointment to the cold sores as they appear or when you know you're about to get them. And then for HSV2, which is genital herpes, there's episodic therapy, which means that you don't take any type of medication until you know that they're about to appear. And when they're like just about to appear, you start to use the medication. If you wait until they've already appeared, then it's not really going to work as well as what it would before. And then there's also suppressive therapy, which basically suppresses all of your symptoms. These are for people who are willing to take the medication daily. As for which populations are at risk, for HSV type 1, 3.7 billion people under the age of 50 have this virus. 87% of the population in Africa have this virus because, I mean, think about it, like, they don't have the resources that we have here in order to prevent this virus from spreading. And then 40 to 50% of the population in the Americas has it. As for HSV type 2, 417 million people ranging from the ages of 15 to 49 have this. 31.5% of the population in Africa have this, and then 14.4% of the America population has it. And this genital herpes is more common in women than men because it's easier for men to give it to women. So 20.3% of women have it compared to 10.6% of men. And the prevention for this, for HSV type 1, basically, like, don't drink after people who have open sores. Don't kiss them. Don't eat after them. If someone has an open sore, it'd be best just to not do anything that they have already touched with, because then if you go to touch it after them, you will more than likely get it. And then for HSV type 2, you need to use condoms. I mean, it's not the best thing, but it can definitely help with a lot. And then if your partner has an outbreak going on right now, or they haven't been tested, then you need to have them tested, and you need to refrain from having sexual activity with your partner while they are having an outbreak. And that is the end of my presentation. I hope you enjoyed.